All right, today we are diving into something called an osteochondroma. It's known as the most common benign or non-cancerous bone tumor out there. But here's the thing, calling it a tumor is only part of the story. And once you understand why, you really start to get what this condition is all about. So here's how we're going to break it all down. First, we'll get into what an osteochondroma actually is. Then we'll look at who gets it and where it typically shows up. We'll talk about what it feels like, what problems can arise, and then get into the most serious complication you need to know about. And finally, we'll wrap up with how it's diagnosed and treated.
Let's just kick things off with a question. If you had to take a guess, what do you think is the most common non-cancerous bone tumor? Well, you've probably guessed it by now. It's the osteochondroma, the whole reason we're here today.
So let's jump right into our first section. What is an osteochondroma? And really pay attention to that subtitle, because this is where it starts to get, well, a little weird. Okay, so even though it has tumor in the description, the key thing to understand is that it's not a true neoplasm. Think of it less like a tumor and more like a developmental quirk. It's basically an overgrowth that happens when a little piece of cartilage goes rogue near a bone's growth plate. And this slide really nails the difference. A true tumor, a neoplasm, that's when you have this uncontrolled, abnormal new growth of cells. It's kind of like a rogue contractor building something totally new and bizarre on your property. But an osteochondroma, a developmental lesion, is different. It's more like the original builders just decided to add an unplanned extension to your house using the original blueprints. The tissue is normal. It's just growing out where it shouldn't be. Okay, so who actually gets these things? Let's build a profile of the typical person because it's actually pretty specific. We're talking about who, when, and where. The classic case looks like this. It usually pops up in kids and teenagers, somewhere between 5 and 15 years old. And for whatever reason, it's more common in boys. But here's the most important part. Since it's tied to the growth plates, it grows with the person. And then, once they're done growing, it stops. Completely. That's a huge clue. And where do they show up? This chart tells the story. By far, the number one spot is around the knee, so on the lower end of the thigh bone or the upper part of the shin bone. The second most common place is the upper arm, right up near the shoulder. So what does it actually feel like to have an osteochondroma? For most people, the experience is, well, surprisingly uneventful. And that's really it. For the huge majority of people, it's just a hard, painless lump that doesn't move. A lot of the time, people don't even know it's there until they find it by accident, maybe on an X-ray they got for something totally unrelated. But what if that painless lump suddenly starts to hurt? Well, there are really 4 main reasons why that might happen. You could get bursitis, which is just inflammation right on the tip. The little stalk connecting it to the bone could actually fracture. It might start pressing on a muscle or a nerve nearby. Or, and this is the one we really have to pay attention to, it could be a sign of something much more serious. And that leads us to the most critical part of this discussion. Because even though these growths are almost always benign, there is a small but very real risk we need to talk about. The source material could not be more clear on this. The single biggest danger, the most serious thing that can happen, is that it turns into cancer. And the specific cancer we're talking about is usually something called a chondrosarcoma. That's a cancer of the cartilage. And that's exactly why that little cartilage cap we talked about is so important. So how do doctors spot this change? They have a kind of 5-point checklist. Number 1, the lump starts getting bigger fast. 2, pain appears out of nowhere. 3, and this is a big one, any growth at all after you're done growing. The last 2 are things they see on scans. On an MRI, if that cartilage cap is thicker than 2 centimeters, that's a major red flag. And finally, on an image, the edges start to get blurry, where you can't tell where the normal bone ends and the growth begins. Okay, so keeping all of that in mind, let's move on to how this thing is actually diagnosed and what the treatment plan looks like. When it comes to diagnosis, you run into a classic iceberg problem. The first thing a doctor usually does is get an X-ray. And yeah, it shows the bony part of the growth perfectly fine, but it's hiding the most important piece of the puzzle. And that hidden part is the cartilage cap. It's basically invisible on a regular X-ray. This is why when you feel the lump, it often seems way bigger than what you see on the film. And that invisible cap is exactly what doctors are watching, especially if they're worried about any of those signs of malignant change. Now, what about treatment? The philosophy here is about as straightforward as it gets. If the osteochondroma isn't causing any symptoms, no pain, no problems, the standard approach is to just leave it alone. But if it starts to cause pain or interfere with things, then the solution is surgery to remove it. Simple as that.